Well, hi. On today's show, I want to take a look at several mumps outbreaks on colleges and universities on the east coast of the United States that have popped up since around mid September. And there's been several of them. So I want to take a look at them, and we'll take a look at mumps and the vaccine in a little bit toward the end. But let's start out with the College of Charleston. So we're in South Carolina. And what we know now is two more cases of mumps have been confirmed by the College of Charleston after an outbreak of the virus was announced in September. This brings the total number of mumps cases at the college to 7. The outbreak began with 3 cases of the virus being confirmed last month, according to South Carolina health officials. The 3 cases were a mix of both vaccinated and unvaccinated individuals. And that's a very important point we're going to talk about a little bit later. But let's go ahead and move up the coast a little bit. And then North Carolina, and there's a university called Elon University. And this is actually from the school's website. And in a letter to students, faculty, and staff, it says, in the time since our last email update on Wednesday, October 2nd, 3 additional cases have tested positive for mumps, bringing our total number of confirmed cases to 6. However, there have been no other additional suspected cases during that time. And they're working with health officials in their county to get the outbreak on the Elon campus under control. And also in North Carolina, High Point University is in the news. And High Point University is taking action after Guilford County Health Department helped confirm 11 cases of mumps on campus. The university continues to follow protocol to ensure that students impacted receive appropriate care and have been provided with alternative housing, according to the school in their own news release. So 11 cases there, 6 in Elon, so that's 17 in North Carolina in just the past couple weeks. Continuing to move up the coast, Ferrum College, this is in Virginia. And this report notes that Ferrum College officials have confirmed 5 cases of mumps on this campus. While it's not clear when the first case was diagnosed, an email was sent to students, faculty, and staff members Tuesday talking about the outbreak and how to prevent contracting it. So of course, the Virginia Department of Health is assisting the school with this outbreak. And they say that the exact number for the Commonwealth so far in 2019 is 34 cases. And we're going to take a look at the overall U.S. numbers in a moment. And then up in Pennsylvania, which Pennsylvania's been hit pretty hard with mumps in 2019, Moravian College in Pennsylvania says Moravian College now has 8 confirmed mumps cases, with 6 more probable cases reported to the Bethlehem Health Bureau. On September 16th, the college began treating the first student in a mumps outbreak on its Bethlehem campus. And they note that the CDC categorizes an outbreak as 3 or more cases. College spokesman Michael Corr said Tuesday the 14 confirmed and potential cases represent the most current figures available. So just in this short piece, 7, 13, 24, 32, almost 40 cases of mumps in the past 2 weeks amongst these few universities on the East Coast of the United States. Now, the East Coast of the United States has seen a lot of mumps this year, and it was most notable earlier in the year with Temple University, who had quite a large outbreak on campus during the spring semester. And this is from Temple, and we covered this very closely on the website outbreaknewstoday.com. And in between February 24th and about June 1st, you can see the numbers here. And this is just students. It doesn't include non-students and staff. There was 169 cases in those few months of time at Temple. So clearly one of the larger outbreaks, if not the largest, on a university this year. So mumps, what does it look like in the U.S. this year? Now we don't have any data that's more recent than a month ago, but according to the CDC, from January 1st to September 13th, 47 states and Washington D.C. have reported 2,363 mumps cases to the CDC. And if we take a look at this map, let me blow it up a little bit. You can see that, right, mumps has been in just about every state. We see three of them without it, right? New Hampshire, South Dakota, and Wyoming, according to this map. But we've seen the darker the color, the more mumps, and we can see Pennsylvania is right up there as being some of the most. And I've seen some figures say that there's been more than 300 mumps cases in Pennsylvania this year. And of course, a big bulk of that is due to Temple. And then, of course, Texas has a lot of mumps this year. And I believe a lot of that is due to the detention centers down there where they've seen a lot of mumps cases. So it's really common to see mumps outbreaks in the university setting. If last year or the year before we saw it, there was a bunch of Midwestern colleges that were reporting outbreaks. But right now what we're seeing is, and I thought it was a little interesting that a lot of these East Coast schools have reported mumps outbreaks in just the past week or two. It's since middle to late September, and that's not really all of it either. There's been reports of mumps outbreaks in not colleges, but like middle and high schools on the east coast of Florida. I've seen reports out of some of those counties. So we are seeing a lot of mumps cropping up very recently on certain areas of the country, particularly in the East Coast. And let me continue on. All right, just a little bit about mumps. Let's go over the signs and symptoms real quick. All right, it's really well known for the puffy cheeks and the swollen jaw, and this is due to the swollen salivary glands under one or both ears. And then they have a lot of non-specific symptoms that you may see prior to the swollen jaw and the puffy cheeks. Fever and headache and just being really tired and the like. Symptoms appear about 16 to 18 days after infection, but there's actually a larger range, but typically very mild symptoms. However, there are complications that do come around with mumps that we don't hear a lot about because it is typically a mild disease. However, there are complications, and the CDC spells some of that out, particularly in adults. Inflammation of the testicles or orchitis in males who have reached puberty. This may lead to decrease in testicular size. Inflammation of the ovaries and or the breast tissue in women. Inflammation of the pancreas. Encephalitis, inflammation of the brain, probably one of the more serious side effects. Deafness. And I don't think the deafness is super uncommon. I mean, it's not super common, but it happens from time to time. We've seen that in different reports. So there are complications that come along with mumps. Can we prevent it? Well, the answer is yes, with caveats. Mumps, the best way to protect somebody from mumps is the MMR vaccine, right? Measles, mumps, and rubella. Mumps is the least effective portion of these three viruses is supposed to protect you from. With one vaccine, it's about 78% effective. With both shots given as a child, it's about 88%. And that compares to what? 97, 98% when it comes to measles. Children should get their first dose at 12 through 15 months of age, and the second dose at 4 to 6 years of age. Very safe, reasonably effective vaccine, very few side effects, and the side effects that are present are typically very, very mild, fever or a rash. And mumps outbreaks still do occur, and we do see this, and particularly in the university setting and other close-knit communities. The mumps vaccination program started in the U.S. in 1967, and there has been a more than 99% decrease overall in the United States. So if we're seeing 2,000 cases now this year, that doesn't even compare to what we used to see prior to the vaccine. Now, during these outbreaks, people who previously had 1 or 2 doses of MMR vaccine can get mumps too. And that's what we're seeing. We saw that, and I think it was the College of Charleston. They said some were vaccinated, some were unvaccinated. Experts aren't sure why vaccinated people still get mumps. It could be that their immune system didn't respond as well as it should have to the vaccine, or their immune system's ability to fight the infection decreased over time. One thing we do know is disease symptoms and complications are milder and reduced and less frequent than people that are unvaccinated. And also, high vaccination coverage helps to limit the size and the duration and the spread of an outbreak. Now, one thing we've seen on college campuses for the past several years is in a mumps outbreak, sometimes the local public health authority will recommend an additional dose, a 3rd dose of MMR for people who belong to some of these increased risk groups, like in the university setting. And that's typically the decision made by the local public health authorities or the college itself, or some combination of the two. So that's always a possibility. So anyway, that's just a quick summary of what we've been seeing in the past couple weeks at some universities and college up and down the East Coast of the U.S. A little bit about the symptoms of mumps, how large is the case count in the U.S. this year, and a little bit about the vaccine, its effectiveness, and what can be done in certain cases, like on a university outbreak. Anyway, I appreciate you watching. Subscribe to the channel, like this video, share it with your friends, comment below, and I'll see you next time.